Memorial, nuclear oncology represents the forefront of technology in cancer diagnosis and treatment. Through advanced molecular imaging, cancer cells can be detected at their earliest stages, and targeted therapies allow us to treat only the diseased tissues. This makes treatment more effective, safer, and uniquely personalized.
Hello, I am Professor Dr. Akın Yıldız. I work in the Nuclear Medicine Department at Memorial Göztepe Hospital, and today I will briefly talk to you about what we do in the field of nuclear oncology and give a short overview of our working methods in our department. When we talk about nuclear oncology, we mean the use of radioactive substances for oncological purposes in the diagnosis and treatment of cancer. In summary, nuclear oncology is a field that, in recent years, has become increasingly integrated with oncology, focusing mainly on imaging and also treating certain types of cancer. The most commonly used molecule in nuclear oncology is a molecule called FDG. This examination takes advantage of the fact that cancerous tissue uses more sugar than normal tissue and is necessary to detect the spread of cancer throughout the body at the initial stage, to predict how aggressive the cancer might be, to identify distant metastases if the cancer has spread to other parts of the body, to see if it has spread to the lymph nodes, and to enable proper planning. This examination, which we call PET-CT, can also be performed using a different molecule instead of FDG, for example, in prostate cancer. We call this PSMA PET. Although rare, there is a method called DOTA PET used in a group of diseases known as neuroendocrine tumors. This time, by using that, we are able to observe the spread, staging, and status of the disease in the body specific to that illness. In addition to this initial assessment, nuclear oncology is also a very important field for re-evaluating the disease status after treatment has been administered. Apart from these imaging methods, we also have the opportunity to perform targeted nuclear therapies for treatment purposes by using certain smart molecules, which we call targeted agents, together with radioactive substances. Here, the most commonly used method is to administer a molecule called lutetium or actinium PSMA to the disease areas detected on PSMA PET scan, allowing us to provide targeted therapy. We can do the same with lutetium and actinium for the disease areas we see on imaging with what we call DOTA PET, especially in the group of diseases known as neuroendocrine tumors. Many new molecules are being developed. There are increasingly more integrated evaluations being conducted together with oncology. At Memorial Göztepe Hospital, what we routinely do is to ensure that nuclear oncology is integrated with medical oncology in a multidisciplinary way, working together with all clinics to evaluate and follow up with the patient. I wish you all healthy days.